Greetings, Doctors Eldridge, Soley, and fellow classmates. I'm Maria Rivera. I begin this discussion with the question, what is clinical mental health counseling? According to Heather Smith, Carl Rogers was enormously influential when he presented his views on creating an atmosphere which fosters the individual's innate ability to heal. Rogers' conditions of congruency of the counselor, empathy toward the client, and unconditional positive regard introduced a new stance for clinical care. His first book, titled Counseling and Psychotherapy, reconstructed the counseling approach and made a distinction between the counselor's roles and objectives and those of psychologists and psychiatrists. This paved the way for what we now call clinical mental health counseling. The American Counseling Association defined a professional counselor as, and I quote, one requiring advanced knowledge and general practice of professional counseling, while the American Mental Health Counselor Association stated its mission is, and I quote, to enhance the profession of clinical mental health counseling through licensing, advocacy, education, and professional development. Heather Smith explains an important distinction in the role of clinical mental health counselors is their philosophical stance, which concentrates on strengths of the individual versus the medical or expert-focused approach to care traditionally used by psychiatrists and psychologists. Elizabeth Walfair describes the clinical mental health counselor as a guide and an advocate who strives to improve client functioning through understanding the client's position in a multicultural context, advocating injustices which may impede normal function while striving to empower the client toward autonomous advocacy. The clinical mental health counselor is guided through moral principles and ethics codes which center on the principles of autonomy, beneficence, non-maleficence, justice, and fidelity. Watson et al. Points out that society benefits greatly through clinical mental health counseling due to CACRIP's stringent educational standards, which paved the way for approval of counseling services by third-party payers. This has allowed for more widespread care and accessibility. Additionally, client welfare is safeguarded as accountability is increased. Welfare also explains that because we live in a diverse society and multicultural counseling is a vital component within the clinical mental health framework, society benefits from treatment which is custom to clients' various worldviews and is also empirically proven. Shapiris and Ellis outline the counseling process in a step-by-step manner. First, the counseling environment, which consists of the counselor's characteristics and physical location, and is set up to create a safe and relaxing atmosphere. Next comes the important step of informed consent and confidentiality. This cannot be ignored because of the implications to the client should information which requires mandated disclosing be given. The third step is intake, and such relevant information as client's marital status, why the client is seeking help, the history of the presenting problem, family background, any abuse history, medical history, educational background, and occupational background are provided to the counselor to form a solid base to work from. The fourth step involves exploration and working together to devise a treatment plan. And next is the goal-setting stage. The counselor and client work together to create goals which are developmental, remedial, and rehabilitative in nature. The counselor's sixth step is in the examination of treatment efficacy, which involves the application of theories and techniques to help the client live in an adaptive manner. Finally, the seventh step is that of positive counseling outcome, and here it is determined whether the goals have been met and if the client is in a better state than one entering counseling. Termination occurs with mutual consideration to met goals, and Welfare and Patterson explain that termination occurs in a series of stages which ultimately leave the client feeling empowered. To be an effective counselor, Shapiris and Ellis indicate three important components a counselor brings into the counseling process. They are training, experiences, and personality. Lynn Shallcross quoted Thomas Sweeney as saying, and I quote, "Research goes hand in hand with being an effective counselor or counselor educator." Sweeney contends an effective practitioner or counselor educator must stay abreast of the most current literature, including that associated with research outcomes. It is a professional and ethical responsibility to seek best practices, to advance our understanding of client needs, and to continually find more effective ways to serve all who need our services. Shapiras and Ellis further explain the need for self-awareness, knowledge of other cultures, especially that of clients, and flexibility with strategies which line up with the client's cultures and views. In terms of experiences and personality, Shapiras and Ellis quote psychoanalytical theorist Carl Jung when describing how persona and behaviors are due to our collective unconscious, which is the compilation of our life's experiences. They further quote Kotler in describing how a professional counselor must be vibrant, inspirational, charismatic, sincere, loving, nurturing, wise, confident, and self-disciplined. A counselor must also be willing to become vulnerable in the presence of clients. I conclude by listing 10 guidelines to effective counseling by Nash and Nader. They are paying attention to the context of the meeting, which includes time setting and physical conditions of the client, being aware of nonverbal signals, believing that the client has the ability to solve his or her problem, listening effectively, talking simply and clearly, asking and answering questions effectively, expecting and handling resistance to change, building a resolution of the client's problems, and finally inviting client feedback on the counselor's process. Learning to operate this efficiently does not occur in an instant, nor does it happen during training. This is ongoing and comes with dedication, commitment, resolve, and care for both the client as well as the counselor. Thank you.